Us to talk about the business as a whole and what he expects going ahead. Bhavdeep, hi, good morning and thanks for joining us. You know, there's a lot of buzz now, a lot of interest in the hospital space as a whole because we have a new player that's getting listed very soon. But can you just give me a sense of what the expectation is going ahead for Fortis itself? What could the growth look like in FY17 and where will the trigger come from?
Good morning. Thank you very much. It is a very interesting time to be in the healthcare industry. We have a nation where the disease burden continues to go up. We have more and more people that are getting diagnosed with various ailments, and on the one hand, that certainly presents many challenges for our country, many challenges for the citizens of India. At the same time, I see Fortis playing a very significant role in helping build a healthier India as we go forward. So 2 or 3 things that I probably share with respect to your question. I think that Fortis today operates 55 hospitals. We have about 4,500 beds. I think as I look forward, 2 or 3 things are going to happen. One is that, as you're all aware, as you might be aware, over the last 2 or 3 years, we spent some time building our overseas expansion. We spent a good bit of time, good bit of resources, and we've made a decision to pull it back in, bring it back in. And our focus is on India today, exclusively India. Every bit of our interest is in India. We have one pathology lab that's in Dubai, which at some point we hope to be exiting soon as well. But beyond that, our interest is strictly in India and serving India today. With respect to what's happening in India, we see a good bit of growth coming from our existing hospitals. Our business continues to do well. Our top line, we're growing at double digit, and we expect to see that continue for the foreseeable future.
So can you give us some numbers, Bhavdeep?
We can actually double our size with respect to beds.
Okay, yes, I was coming to that. From 4,500 beds currently, in the next about 1 year or so, how much will your beds grow to?
I see our bed size actually doubling. We can actually double our bed size without adding a single hospital. With respect to just existing hospitals, building towers, adding floors, just expanding bed capacity. So I think you can see our bed size growing anywhere between 10, 15, 20% over the next 4 or 5 years, and doubling, certainly without any issues at all, without adding any new hospitals. The other form of growth, apart from adding beds, the other thing that from a growth perspective is clinical programs. The country's disease burden dictates what you do, the kind of medical expertise you provide, and the clinical solutions you provide. So if you think back to India 10, 12 years ago, where cardiac was the mainstay, and everybody was talking about heart disease, and that was certainly a big challenge. And then after that came the neurosciences, after that came diabetes, orthopedics. Today, oncology, cancer presents a big challenge. 1 million new cancer patients are getting diagnosed in India every year. Organ transplant is a big opportunity and a big way to serve India as well. We have 500,000 people that die in India every year because they don't get an organ in time or get an organ made available to them at all. So Fortis is moving forward quite significantly in these areas. And certainly I think growth, again, from a bed perspective, from a clinical perspective, and obviously improve patient care. So I think the growth picture continues to be very rosy, and we're all quite optimistic about what's happening at Fortis with respect to that.
Okay. Well, Bhavdeep, just wanted to highlight that it looks like Path Labs will, Lal Path Labs will list at about 720 rupees. That's a fairly strong listing. Always expected to be above 700 rupees, but this is a fairly strong listing, makes it even pricier. Even at 550 rupees, it was about valued 37 times historical earnings, and now perhaps it's over 40 times. So that's the listing, that pictures that are coming to you. Both Alkem as well as Dr. Lal Path Labs have listed very strongly, or expected to list very strongly. Alkem listing is expected to come in at 1380. That again would be very strong. Always expected, because the subscription was 45 times, so it was expected that it's going to be a very strong listing. On that note, Bhavdeep, the pathological labs are listing at such attractive valuations. Should we hear something about SRL from y'all, listing of SRL?
No, we, as you know, we are a joint entity today. Fortis and SRL work together. As a financial structure, we sit together as well. I don't see us doing anything different right now. I think, I think that in 2-3 different ways, the collaboration sitting together makes sense. Financially, we believe it's the right way to do it. But beyond that, I think from a business partnership, from a diagnostic relationship that we have with them, I think the structure works fine. We have a fantastic team led by Sanjeev Vashisht, who runs SRL for us. We continue to do well. Our returns there are exceptionally strong as well. We're seeing very strong growth numbers there as well, whether from a revenue perspective, from an EBIT perspective. I'm very happy with our structure. It works in every respect. It's good to see what's happening, with respect to valuations. I think that's a great thing. But quite honestly, our focus is let's continue to drive great patient care, and the collaboration partnership works well. No need to separate it.
Actually, on that subject, one of the reasons why some of these path labs are getting lapped up on the exchanges as well is because of the way the margins are growing in this business. For example, Dr. Lal Path Labs, that will get listed in just 5 minutes from now, has been seeing consistent margins of 24-25% over the last 6 years. And so has SRL. Do you see the margin profile for the Path Labs business grow further in the next couple of years?
I do. I think 2-3 things are going to happen. I think generally, big business, I think all our industries, all companies, SRL specifically, I think we're all becoming better at what we do. We're becoming more efficient. We're reducing cost in our structure as we go forward. But I think that's happening is the complexity of tests. The disease burden. I keep talking about the disease burden, but that's what you have to talk about. As those the innovation, the research, the trials that we're running, the complexities building out even more and more, greater expertise required. And as a brand, we are distinguishing ourselves. We have distinguished ourselves. So SRL stands as a very strong brand, very, very respected, well-recognized. I think the margins are fantastic. They are in the mid-20s that you just referenced. And I don't see any reason for them to go backwards. If anything, I think that as we go forward, I think you'll see more of the same and potentially further and better numbers, in fact, as we go forward.
Okay, so give us an idea of how the hospital business margins will pan out. What's your occupancy at this point in time?
Our occupancy numbers are in the mid-70s right now. And the hospital, the occupancy numbers, as you probably recognize, vary over the course of the year. So at dengue season, for example, it's a very, very high occupancy. We ran in the mid-80s, high 80s. Some hospitals approaching full 95, 98%. So the occupancy numbers vary. At this time of year with Diwali, with the holidays, because so much of what happens in healthcare is planned, whether it's surgeries, whether it's procedures, they dip a little bit. Right after the new year, we expect them to go up as well. So the hospital business, the prognosis is very healthy, very significant growth that we see. You've heard me talk about the number of beds that we have and the beds that I think will continue to add. I think our expertise around the various medical specialties will continue to grow. The investments we're making, we just invested in our first robotics program in Gurgaon, where we invested over $2 million in building a brand new robotic system. I think that'll continue to drive business as well. And I think the brand continues to get stronger. I think that no matter where you are in India, where you see Fortis and you see the Fortis hands, that represents healing. And I think the occupancy will grow. I think the margins will grow. I think we're becoming better at what we do. Our costs are going to continue to come down. I think the picture is very, very rosy. We're excited about what we're doing. We're excited about helping heal India and building a healthier nation as we go forward.
That's very good to hear the progress you guys are making in medicine. But I just wanted to ask you specifically about this 100% stake that you're looking to buy or that you have bought in Religare Health Trustee Mgmt. Can you just take us through the rationale behind this deal?
The rationale is very simple. From a financial structure, every company, every organization looks at the structure you have. You asked me earlier about the SRL piece, for example. After an internal diagnostic, internal assessment, I think the decision we've made is it's sitting exactly the way it should. It makes perfect sense for us to be sitting as a joint entity. Similarly, we look at all financial structures, and we assess what's the best way to go forward. And there has to be a practical application. I mean, at the end of the day, financial structures are just that. We are trying to maximize what happens inside the hospital. So I think that moving and transitioning what we're doing there with respect to the structure there with the trust piece, I think it makes eminent sense. I think the big story here, and that's the one piece that I'd love to share with all of you, because while we're discussing the financial numbers, we're in the healthcare industry. We're in the business of healing people and helping people become healthy. And I think all of our focus, while all these questions are wonderful, and I love answering questions about our finances, and we have a great story to tell, the real story at Fortis is what we're doing for patients and the clinical environment that we have around driving fantastic outcomes. We are going to become the first organization that's actually starting to report clinical outcomes in India today. So. Great story. Love to talk more about that.
No, but
the financial structures.
we have to look at the
we have
financials.
A great finance team that works on that.
Bhavdeep, we
more
have to.
And more.
We have to concentrate on the financials.
Of course you do, but hopefully.
No, just a word.
Hopefully.
Bhavdeep, we're out of time. I just wanted to know
but of
what
course
are your
financials are merely outcomes.
No, I just want a word on Fortis Health, Fortis Malar. What are the kind of growth opportunities and margin numbers at this point in time? Growth and margins, do they compare with the main Fortis?
The Fortis Muller story is a fantastic story, and I know we want to talk about numbers, but I have to talk about the healthcare piece and the patient piece. We've become the largest heart transplant center in India and the second or third largest in Asia. Certainly that drives our brand. The Fortis Muller brand is becoming stronger and stronger. The city of Chennai has gone through some terrible times with the recent floods, the challenges we've had there, but we've recuperated really well. We've done a lot of work in the community with free OPDs and taking care of patients. So I think the numbers there are great. I know we've seen some rise in the stock with what's happening, but I think the Muller story, the Fortis Muller story, will continue to do well on a financial basis. We've reported good numbers. I think the story there is going to be just as strong as you see in the rest of Fortis.
All right, we'll leave it at that, Bhavdeep. Thank you very much for joining us with those details.